We're going to give you a brief flyby on scoliosis. Two kinds of scoliosis that we typically see in our practice are structural scoliosis, which is a fixed scoliosis, idiopathic usually, and it is a scoliosis that does not change. Scoliosis that does not change during forward bending, side bending, back bending, the curve stays the same. That's a fixed scoliosis, and it sometimes can barely be helped, but usually don't expect great miracles from that. What we do see, and the most common curve that we see, is called a right thoracic scoliosis that I've drawn here on Michelle because she does not have this condition, but I want to demo it and show you how we would treat it. So this is what the spine is actually doing. She's side bending left. Her spine is side bending left, although it often looks like it's side bending right because she's rotating right. There's a hump right here. This is the hump, right? It's a right thoracic scoliosis with the hump all the way through here. That's because she's side bending left, like here, this is left, and as she rotates right, the ribs are protruding. So that's what the hump is, the ribs right here. So we can usually get that out. To tell whether it's structural or functional, we have her just bend forward. If she bends forward and the curve starts to go away, it's fixable. We can take all that out. That's a functional scoliosis. If it stays, if it does not go away, we still work on it because there's always a functional component to every structural scoliosis. I'm just going to walk you by the soft tissue stuff that you do first when they're on their stomach because I want to keep this short. You bring all of the tissue, it wants to migrate laterally. You want to bring the erectors and all of the tissue back up onto the hump. Bring it right back into the midline, so you get particularly the iliocostalis and longissimus. Bring the iliocostalis and longissimus and all this fascia with it, everything back in toward the midline to put a compressive force on that. And then you will come over on this side of the spinous processes, and this tissue here is going to be the guy wire tissue. It is holding that pattern, the bowing pattern. This is the tissue that's really the problem. It's holding that bowing pattern. So I just come right off here onto this side of the groove and then move all this tissue out. Dig it out, move it out, get it loose, and then we're going to go on to the next correction that's seated.